Good morning. It will be great pleasure to share my views with you about augmented reality. Healthcare IT and Hitcon, we are all aware about this is the third edition, and we are trying to attempt to transfer healthcare with technology. That is our main purpose, and that is the reason we will be talking about healthcare IT. Now in that, I am going to be talking today about AR, which is augmented reality, and VR, which is virtual reality. So augmented reality, virtual reality, and a subspecialty of augmented reality would be medical augmented reality, which is MAR. So that is what I am going to be covering. This is almost sent to all of you, and I believe that one screen biodata does not require to be read. Those who are interested, CS Buch, available on Facebook. Otherwise, not interested, no need to discuss about it. So we go to digital health. Now, digital health revolution has made a big change in the mobile health and e-health, wearable sensors, by patient-centered medicine, and leverages the internet and social, competitive and collaborative. Just now, this doctor, we were taking photograph outside and we already put on the Facebook. So digital health, new technologies for healthcare have major trends. First is the transformation from analog to digital. Second is from location based to and time based to anytime, everywhere. So we can be anywhere, patient can be anywhere, and we still can have consultation or opinion, and it is patient focused and patients engaged in their own care. Gone are the days when there was a infectious disease. You gave a course of antibiotics, patient was already. Now we are talking of NCDs, and in non-communicable means lifestyle diseases, the patient himself or herself has to participate. I can say walk 5 kilometers, but the walking has to be done by the patient. So now nothing has remained the same. Digital health has changed every medical device, almost reinvented. BP instrument is just not the same. What you are seeing here also is not the same. Now it is Bluetooth BP instrument. You have Bluetooth weighing machine. You have Bluetooth temperature. You have everything that is Bluetooth, and therefore you are connected even when the patient is on a cruise. So we used to do physical, and today also in America the word used is that if you go through the physical this year, so by physical because we do physical, but now we are going digital. So the combination of the two is physical, and this physical is a combination of the two. I think they have learned from our caterers, Sri Ras and Sri Khand. એમાંથી અમે આમ્રખંડ, આમ્રરસ અને શ્રીખંડમાંથી આમ્રખંડ બનાવે છે. એવું આમાં ફિઝિકલ જેવું થયું છે. અને એની અંદર પ્રિવેન્શન એન્ડ વેલનેસ, ઓબ્જેક્ટિવ એસેસમેન્ટ, improved endurance, facilitating the behavior for various disorders including post-traumatic stress disorders and management of chronic conditions.
Will take care of the pain. So we will be covering little about it. Whenever you see, yesterday when I was talking in JIC, change, and a changing scenario says that the essence of reality is changing. This picture tells you about the surroundings and you have taken a photo is a real, whereas this is virtual reality. So what is the difference? Vadharvu, sudharvu, enhance karvu. So augmented reality is a field of computer research which deals with the combination of real world and computer generated data. I think before we go ahead, not looking at this picture, but let me tell you that when you see a match, I think I will make everything else will make it very simple once you have the context. When you see a match on a TV, the ground is real, the player is real, the ball is real, પણ એ ટપ્પો પડ્યો અને ક્યાં ગયો, કેટલા ક્યાં પડ્યા, કેટલા શોર્ટ બોલ હતા, કેટલા લોંગ બોલ હતા, કેટલી સિક્સર મારી, સિક્સરની કેટલા કેટલા મીટર સુધી ગઈ હતી એ બધો ડેટા જે સુપરઇમ્પોઝ કરવામાં આવે છે તમારા સ્ક્રીન ઉપર, that is augmentation of the view of the real world that you are seeing. With that in mind, now we go to medicine. So it will be easy because this you have been seeing every day, but you have not been told that we have augmented the reality. So now we'll talk about that. So augmented reality will augment. તમારા હાથમાં કેળું છે તો કેળામાં શું છે એ તમારા મોબાઈલ પર તમને દેખાશે. That is augmented reality for diabetic patients. So augmented reality combines real and virtual objects in a real environment. It is interactive in real time and it registers real and virtual objects together. એટલે તમે એક તમારા બેડરૂમનો ફોટો લઈને આઈકિયાના સ્ટોરમાં જઈને ફર્નિચરનો ફોટો લ્યો અને પછી તમે એને જ્યાં ત્યાં ફેરવીને રૂમમાં જોઈ શકો. તમારો રૂમ ત્યાં જ છે, ફર્નિચર અહીંયા છે, બેને જોડી શકો છો તમે રિયલ ટાઈમમાં. Would show that he is sitting in Parekh Auditorium in AMA in Gujarat, in Ahmedabad. So that is additional information. Clicking on that, you will get that augmented information about him. So this is the advantage, and conveniently it is real time and it is, as I told you, like cricket match. Now there is two extremes. We are aware about the coronary spectrum. So I am talking about the AR VR continuum. It is a continuous process. On one side you have real world, on the other side you have virtual world, and between the two, if you enhance the virtual world, it becomes augmented virtuality, and if you enhance the real world, it becomes augmented reality, and in between the two, it is the mixed reality, right? You have on one side, the life is a journey from conception to death. Now you have asymptomatic disease, you have angina, and you have obstructive disease, you have MI, you have arrhythmias, you have death, but there are combinations of on both the sides. So augmented reality is in real world. It is lets people interact with each other, and it is generally by holding a smartphone in your hand, whereas virtual reality is putting on a head gadget, right? Now, like we use Venn diagrams, Japanese use what they call ikigai. So this is an ikigai of reality, and it is telling you about what is an immersion. Immersion is total immersion means virtual reality, and partial immersion means augmented reality. So you have either augmented reality, gaming, VR. Combination of the two is a augmented AR games, you have VR games, and in the center what you have is a total immersion. So combination of all of them. So friends, why are we talking about this in an inaugural lecture in Hitcon? Because this is the likely trend which is going to come. We are outdated, and our practice is outdated if we are not updated. I want you to notice that the arrow that I have put, who are the people who are investing the most in virtual reality and augmented reality? So the third one is health sector, and so much of the solid blue is the investment in past, and projected investment currently is so high in healthcare sector. And why is it so much? Why now? Why did we choose the topic today? Because healthcare is a big business. Indi Medi અહીંયા શું કામ છે સાહેબજી? કારણ કે healthcare is a big business. Management people are here. Why? Because medicine is a big business. But doctors need to realize that this is a big business. So if you are busy in small routines of your OPDs and clinics, all the business will be taken away by people who actually are trying to help you. And we need to help ourselves. So I am telling you that there is a patient rehabilitation potential of 74, almost $75 billion, and patient care $1 trillion, almost Afghan youth. $1 trillion will be used in the total revenue is going to be 2.8 billion. So there is a very big scope, and the big business in fitness and wellness, where doctors don't come, I want to remain more fit. I want to run more than Dhruvi. And that is what people want to do, and they go, and now they don't go. Muhammad comes to mountain. So for training, for research, for pharmaceuticals, for insurance companies, for everything, there is going to be a need for augmented reality, and these are the fields in which you will see the augmented reality. And therefore, I would say that we need to spend less money on our own self, but we have to spend less money on the technology in our clinics. And kindly understand that there are so many free augmented reality apps which can be downloaded, and some of the slides, unlike US, I will not say that there is a disclosure, but I would want to share that some of the slides are from my cousin, who is one of the 50 best marketers in the country, recently given award, and he is having his company CEO of Go Digital. So Ninad Chaya from Bombay. Now virtual reality, the first thing that it will do is that it will disrupt the current industry, right? Like we have Google self-driving car, like that it will change. So you may not need a doctor, that is what they say. I always say that you can characterize the motion, but you cannot stop the motion, diarrhea, by showing a program. So we are still going to be needed. You may conceive a project, but you never deliver a baby via the computer alone. Three Idiots is a different story. So beyond the telemedicine, that is where telemedicine was used. So telemedicine, then secondly, actively engaging the patients in the treatment for anxiety, for phobia, for various other things. So you have the active engagement of the patients, unlike writing a prescription. These are the free apps which are available for anatomy, for heart, for any part of the heart. You wanted to see any anomaly, you can take that 3D CT scan and then rotate and make it augmented reality, and you are operating on a patient of liver transplant, or as you want to do a segmental resection, hepatic segmental resection, you will come to know that you are going through an artery. So if you have a phobia about something, then you have this PTSD where one is not really holding, but the phobia will go. This is another one. Can virtual reality relieve pain? Yes. On the right side down you are seeing is the US veterans, the army people who are being relieved of pain of burns by augmented reality application. So apart from the relief from pain and anxiety and training, there are other trainings like anesthesia training, not on real patient. These are not simulators. It is much better than simulator used in airplanes, and therefore medical training is very good. ACLS training, you can't reach and call everybody 10 crore people to Baroda, but you can train 10 crore people via the augmented reality on the internet platform. While you are doing surgery and you wanted some data is available. Because patient engagement is there, it makes the healthcare social, and therefore we are more in touch. After friend being on the Facebook, many of you would have realized now patients also feel that they are very close to you because they are labeled as, and you are labeled as their friend, and they are labeled as your friend. So now you would have seen that change in behavior. Ke saheb ane page lagwane bade kem cho saheb. Now there is a friendship. So there is a healthcare is becoming more social. Some few 4 or 5 case studies for virtual reality and augmented reality. So this is Excedrin, which is migraine experience to the relatives. કશું જ છે નહીં, ખોટી ખોટી મારે વારે માથાના દુખાવાની ફરિયાદ કરે છે. એને એકવાર આ બતાવો તમે એટલે એને ખબર પડે કે what does she feel. Husband or daughter or mother will come to know what is the feeling of migraine patients by augmented reality. So that is one. Another one is that when the patient, empathic is the name of the app, and with that a relative has died or somebody has been diagnosed with advanced terminal cancer, how do you communicate? So any training તમને આ આપે. મારા અમુક પેશન્ટને I have told them to use C Hero ક્વેસ્ટ બીકોઝ આ એપ સાથે એક મને સાહેબ ધીમે ધીમે નામ ભૂલાવા માંડ્યા છે, લાગે છે કે મને ડિમેન્શિયા થઈ રહ્યો છે, અલ્ઝાઇમર તો નહીં હોય ને, કંઈક કરી શકું હું, સુડોકુ કરવું એવું મારા મિત્ર કહે છે, આ કરવું આમ મારા મિત્રો કહે છે, તો હું કહું કે આ પણ કરો. આની અંદર તમે 2 મિનિટ કરો તો કંપનીને 5 કલાકની રિસર્ચનો ડેટા મળે છે. તો તમે ગેમ રમો, યુ ફીલ બેટર એન્ડ they get 5 hours lab data. So that I think is helping him, me and mankind and the research. So that is what I mean. So AR technology is very good, and this is just a list that 80 of the practice-based apps, surgery 51, education 29, internal medicine and rehabilitation 23, oncology 16, emergency medicine 14, augmented reality, healthcare news 13, and the augmented anatomy was 10. This is now again game, and like Saap City, Urman Bhai, this is now the the platform has changed and you have to go to augmented reality game. And also for diabetic patients trying to know the composition, the potassium content, the GI value and the caloric value and the glucose content and the sodium potassium, everything is available. So that was about the patient. Now this is about nursing. All of you must have received this in your WhatsApp about the vein finder, AccuVein, so that you can see the veins actually, so you never cross a bridge and do a cross puncture and your chances of making an error become much less. So that was about the AccuVein. This is about the Microsoft HoloLens, and too many things are going to come with Microsoft HoloLens. And you can project the human body, you can click, you can open, you can expand, you can take away the skin, you can take away the muscle, and you can go to the bone, and in the bone you rotate and you see the fractures of 4 different kinds. What is a normal fracture, a craft fracture, a spiral fracture, a comminuted fracture, and everything. So this is about similarly a dentistry. So this is a virtual dentist is another one. Now the use in surgery and OT has been for quite some time, but we are talking now. Virtual reality's research occurred for 30 years and we are talking now because now the time has come. So in 95 operating microscope augmentation was planned. External monitors in 96, 2000 operating binoculars, and in 2000 head-mounted displays, and now we have a step further that while Dr. Jigar is operating, he gets the patient data, the biochemistry, CT scan, MRI, and angiogram, and 5-phase liver scan in the environment while he is operating. So considering all those things, we have a big tool at help to improve the patient care with precision and make it more user friendly. This is what the type of conference that we are having. This was a conference snapshot in Germany. Now Phobias helps you relieve phobia. વેરેબલ ઇન્ટેલિજન્સ વિલ ટેલ ધ પેશન્ટ કે હવે તમારે આને આમ કરવાનું છે, પછી બીજું સ્ટેપ આ છે, પછી આ તમે ડ્રેસિંગ કરો, પછી આ કરો, લાઈક ધેટ. સો perpetually instructions keep coming and you, though you don't know, you can treat the patient. So augmented reality apps and SDKs, there are biomedical engineering students also. So these are the ways. ARCKit and ARCcore and Wikitude are all the software development kits, SDKs, which can be used for developing the programs for the doctors by you for healthcare purpose. Now this is one of the examples of 40 milliseconds of beating heart. CT scan converted into 3D. It will also help you in locate the abnormal coronary, etc. Also very big use in ortho, and this is the kind of an OT that we can expect in future, where a 3D camera with depth is used, and it will augment the reality, both physical and anatomical information, and it will avoid the surgeon from making mistakes and damaging the patient. For neuropathic pain and for blind persons, sonar vision, more better things than retinal displays and cameras have come which can be connected to the optic nerve. So what basically is happening in the reverse, when you take the car in reverse, in some reverse programs, your intensity of the voice, the more you are reaching you are going to collide, tick, 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 it keeps increasing. And there are others where there are cameras. That sound part is used by blind persons for knowing that they don't collide with anybody. So that is the sonar vision. And now 5 billion people in the world who don't have access to safe and affordable surgery. 143 million simple operations need to be done, which will require 2.2 million surgeons, anesthetists and obstetricians. There is a need for speed. આ બધા રાહ જોઈ રહ્યા છે. And there is a need for spread of technology. તમે એક જગ્યાએ 1000 જગ્યાએ જઈ નથી શકતા. So medical augmented reality is the need of the hour. More so in various other parts. આપણને એવું લાગે કે અમેરિકાની અંદર વાંધો નથી, અહીંયા આટલું પોપ્યુલેશન વાંધો છે, but 5 million people in USA do not have an access to the ICU by 1 hour of helicopter ride. Do you get the point? અમદાવાદમાં એવી કોઈ જગ્યા છે, ગુજરાતમાં કોઈ જગ્યા છે, 1 કલાકમાં હેલિકોપ્ટરમાં આઈસીયુમાં ના પહોંચાય? નથી, પણ અમેરિકામાં એવી જગ્યા છે. એટલા માટે આપણે આ વસ્તુની અંદર ઘણું બધું કરવાની જરૂર છે. અહીંથી આપણે અમેરિકામાં મદદ કરી શકીએ છીએ. So join the road ahead and let us think that next time we keep a competition for augmented reality applications for the medical problems at hand in India to solve the problems world over. We are thinking in terms of a sunshine consultation, which is that anywhere in London the cardiologist or the neurologist is sleeping, but in India he is awake. So duty will shift. Wherever there is sun, the doctor will be on duty. At night everybody will be sleeping in their local country. But sunshine consultation will occur. The patient will be same place, but he'll be seen by different parts of the world where there is a contract that neurologist will say, sister, હવે તમે આ injection આપી દો, એને ખેંચ આવી છે. So that is what I mean by augmented reality, virtual reality, connected world. Thank you very much for patient listening.